dear participants, colleagues, on behalf of the Food and Agriculture Organization of the United Nations, FAO, I want to extend a warm welcome to all of you who have joined us for the first session of the social protection track for the Cultivate Africa dialogue. I want to especially thank the African Union and Hallpax for offering FAO the opportunity to chair the social protection track. This is an important indication of your trust in FAO, but also a call for our leadership and continued efforts to champion social protection as an essential aspect of ensuring food security and nutrition, even in times of crisis, and strengthening rural livelihood resilience to reduce poverty for all. It's important to highlight that this conference is organized in follow-up to two major meetings organized under the African Union leadership, aimed to focus on COVID disruptions, impacts, and response. The first among ministers of agriculture in April, and the second among the African ministers responsible for agriculture, trade, and finance, resulting in the July African Joint Ministerial Conference Declaration and Action Agenda on the impact of COVID-19 on food security and nutrition in Africa. I underline that the action agenda commits to, among other things, expand and improve social protection programs for income support, supplemented by emergency food assistance where needed, and provide nutritionally balanced diets through public interventions and social protection programs to ensure that immediate food needs of vulnerable populations are met, and to adjust existing social safety net programs to meet the needs under COVID-19. In this regard, FAO has organized two sessions that bring together a wide range of partners from government, UN agencies, and civil society, including producer organizations, all of whom are key stakeholders operating in the social protection arena, notably in rural areas, to share examples on more inclusive and sustainable response and recovery approaches and interventions to address impacts of the COVID-19 pandemic and other crises that regularly affect this region. The fact that there is a dedicated social protection track for this important event is a testament to the critical role that the social protection is playing as a response mechanism, protecting the food security and livelihoods of rural households from the health, social, and economic impacts of COVID-19. Social protection is receiving more attention than ever before on the continent, having played a prominent role, particularly during the immediate COVID-19 response, to provide food and cash relief assistance to the poorest. In fact, 84% of measures implemented have been social assistance programs, providing cash or in-kind transfers, mainly of food. What we have remarked, however, is that despite the rapid and extensive social protection responses across the continent, national systems were not ready to handle a crisis of this magnitude. Prior to COVID, social protection in Africa had the second lowest percent GDP investment of all regions globally, at just 5.9% GDP, as compared with the global average of 11.1%. Additionally, on average, across countries, only 10% of the population in Africa was covered by social assistance programs. The needs that have arisen as a result of COVID-19 have strained underfunded and underdeveloped systems. COVID-19 impacts have been harshly and deeply felt in both urban and rural contexts, not only by existing poor and marginalized populations, but now by a new cohort of additional vulnerable population groups who are directly being affected by containment measures, income losses, and economic downturns. Many have been left out of the initial responses to COVID-19, despite being among the populations in greatest need. This includes informal rural workers, notably in the agricultural sector, who generally lack income protection typically provided to formal sector workers, as well as refugees, and migrants who are typically excluded from national social assistance and health insurance programs. Now is a good time to look back, to examine and analyze these early responses, identify gaps, and look for ways to strengthen national social protection systems, making them more inclusive, responsive, and fit for purpose to support resilience for different categories of the population. This is vital to moving forward for enabling the recovery efforts and for strengthening shock-responsive social protection systems moving forward. With the spotlight on social protection and the widespread recognition that social protection systems are central to COVID-19 response and recovery, we consider this a great opportunity to build back better. I wish to highlight three particularly important points here. First, we must strengthen the shock responsiveness of systems to ensure an inclusive and timely response so that those affected by crisis are protected and do not become more vulnerable or fall into a long-term cycle of poverty and food insecurity. Second, partnerships are fundamental between government, civic society organizations, including producers, private sector, among others, UN agencies, development partners, and financing institutions to encourage the cooperation and linkages that facilitate effective response and recovery, economic inclusion of the poor, providing a pathway for them to engage in productive activities. And third, investments are critical to bring to scale needed social protection coverage across the continent, appropriately targeted to support particularly poor and vulnerable households in becoming more resilient, ensuring food security and healthy diets, viable livelihoods, and preventing a backslide in achieving the Sustainable Development Goals and the African Union Agenda 2063. Throughout the COVID period, FAO with partners has been relentlessly advocating and supporting efforts to draw attention to the risks of vulnerable groups, including informal workers and marginalized populations, such as migrants, refugees, and particularly agricultural workers, including farmers, fisherfolk, forest-dependent communities, processors, and informal traders, who often lack access to social protection services and are not included in national registries. These groups are facing notable effects in food insecurity, malnutrition, losses of income, including remittances, and decreased purchasing power. As example, the most recent October FAO WFP early warning analysis report that in East Africa, due to COVID-19, in combination with other prevailing crises and risks, the number of highly acutely food insecure people could increase by 73% by the end of 2020, from 24 million pre-COVID-19 to 41.5 million. FAO with other partners are bringing to focus these risks and promoting interventions that are accessible and well-tailored to meet the needs of these populations and rural communities. The current COVID-19 pandemic has revealed the dire importance of ensuring inclusive, timely, and adequate response to crisis. As such, we must work together to identify innovative and scalable solutions to support rural populations throughout response and recovery periods. In this session, we will hear from government, development partners, and the civil society about their experiences with COVID response and engage in an open, dynamic discussion, highlighting gaps, challenges, and good practices to improve inclusivity and strengthen shock responsiveness of national social protection systems. In addition, importantly, our aim is that this exchange will inform and orient the African Union, member states, and also partners in the region in strengthening the social protection agenda moving forward. I thank you all so much again for your participation in this session and your contribution to this wider effort. We look forward to future partnerships. I thank